Good evening, everyone. Hetero Healthcare welcomes all delegates for attending this interactive session on first-time launch in India, Polmacoxib and its role in osteoarthritis. Hetero Healthcare being pioneer in bringing new and innovative solutions in India, considering current gap and need, bringing one more treatment solution for well-being of Indians. I would like to welcome our speaker for today's evening, Dr. Eknath Pawar. Dr. Pawar is professor and head of department orthopedics for Grand Medical College in Mumbai. He have immense and versatile experience in orthocare management. Dr. Eknath Pawar has authored 54 publications so far in the area of orthopedics. Dr. Eknath Pawar will be sharing his experience and insights on use of Polmacoxib 2 mg capsules in osteoarthritis patients and outcome for the same. Now requesting Dr. Eknath Pawar to share his valuable insights on Polmacoxib in management of osteoarthritis. Over to you, sir, now.
Thank you, Arsha. And thank you all the team of Hetero. I will be sharing my screen. Good evening, all the delegates. Today we will be talking about Polmacoxib. This is a newer molecule, more than the COX-2 inhibitors. First of all, we will see little bit about the osteoarthritis. It is a very common form of arthritis. The worldwide prevalence is around 3.3% to 3.6%. It is second most common cause of joint diseases in India, affects almost 40% of a population in India. What are the risk factors for osteoarthritis? Few factors are modifiable, few factors are non-modifiable. So modifiable factors are obesity, which is quite common factor nowadays in metro cities due to unbalanced diet, food habits, and sleep habits are also changed. In the metro cities, working pattern is also changed. So lack of exercises, lack of balanced food, and lack of sleep, and whole pattern is changed. So more or more cases of obesity we can see in metro cities. Second is lifestyle changes are also changed in metro cities. Few occupational conditions where there is more loading on the joints due to lifting of heavy weights. Few positions like squatting, kneeling may cause more stress on the knee and leads to early arthritis. Arthritis is more common in older age group, around 60 or I will say above 60 years. But nowadays, if you see in cities, this has decreased and come down to almost 40 and above 40 people are complaining of ONE and knee pain. Few comorbidities also leads to risk factor for osteoarthritis, diet, as I said, and non-modifiable, which are not in our hand, is age of the patient. As the age increases, the osteoarthritis increases because this is a degenerative disease. So as age increases, the osteoarthritis also increases. Gender, it is more common in females than males due to very much common osteoporosis is seen in females. which was initially above, I will say 60 years of age, but nowadays it is seen in early 35, 40 years of females which are living in metro cities. Due to all these factors, lack of exposure to sunlight, lack of exercise, lack of balanced diet, working pattern, and I will say, if you consider the Mumbai, daily the ladies or gents who are working in offices have to travel almost 2 hours or 3 hours a day, which will be by train. So that also putting more stress on your joints. Genetics is also contributing. So if you consider the family history and all if you have family history of osteoarthritis, then there is likely risk for that. Racial affection is also seen in osteoarthritis. If you consider various risk factors, the more we had seen all these risk factors, and if you consider the mechanical stress on the hip and knee joints, specifically the weight bearing joints. So if there is a change in the mechanical axis on medial side or lateral side, normally it should be little bit medial to the central line in the knee joint. But if it is aligned on the medial compartment of the knee or lateral compartment of the knee, then there will be chance of early degenerative changes on that compartment side. I had seen the cases who have got, if mechanical axis is medial to the central line, then there is more common is medial joint line osteoarthritis. In very few cases where there is a deformities in the knee and your mechanical axis is going through the lateral compartment, that will even cause a lateral OA knee. So wherever there is a deformities around hip or around knee will cause abnormal loading of the joint. Even if you see the cases of limb discrepancy, shortening on one side of the limb, that will also cause changes in the mechanical axis, and that will cause pain or osteoarthritis in hip or knee joint, and also shortening will lead to the early degenerative changes in the spine. So this is little bit about the OA. So what limitation and challenges are there in treatment of osteoarthritis, which is very, very common in our Indian population? So mainstay of treatment for OA knee is we have to relieve the pain. So we use a lot of non-steroidal anti-inflammatory drugs, painkillers, COX-2 inhibitors, and so. And with this, patient may get the pain relief, but progression of the joint damage goes on. So one is non-steroidal anti-inflammatory drugs, COX-2 inhibitors. Then we also use some form of food therapies, or we can call it as collagen peptides, glucosamine. Like these food supplements are marketed by the lot of pharma companies, but we don't know the exact mode of or there is no 100% guarantee about all these food supplements. They are causing little bit relief of, I will say, pain relief, not exactly, but they are doesn't have any assurance about that. What about the other forms of treatment are physiotherapy? In physiotherapy, we can give shortwave diathermy, then ultrasound therapy, and IFT. Nowadays also there is pool therapy is also advisable. That is static quadricep exercises, strengthening exercises of quadricep, hamstring strengthening exercises, hip abductor strengthening exercises. That gives little bit of relief, pain relief to the knee. And we also advise morning walk for half an hour on a plain surface, avoid staircase. So there will be little bit less stress on the knee joint, and that will help in relieving the pain. But all these treatments doesn't have any guaranteed pain relief. So we have to move for a surgical interventions. These are also not foolproof. The option is of knee replacement. Many patients are not willing to do this knee replacement surgery because it is to be done in the elderly patients, and there is a high risk for this surgery. Also, few correction surgeries can be advised if the osteoarthritis in early changes. For example, we can do the high tibial osteotomy to relieve the pain and correction of the mechanical axis. But all these have associated with complications and does not give 100% pain relief. So we'll move to the Polmacoxib. It is a tissue-specific novel non-sterile anti-inflammatory drug, purposely developed non-steroidal anti-inflammatory drug to specifically inhibit cyclooxygenase 2, that is COX2. It is very useful for treatment of pain in arthritis patients. What is the mechanism of action of Polmacoxib? It has unique dual mode of action, inhibiting COX2 and carbonic anhydrase. So here it is a dual mode action. If you talk about the another COX2 inhibitor, it has got only the inhibition of the COX2. But in addition to that, here we get also inhibition of carbonic anhydrase, that is CA. So in tissues highly enriched with carbonic anhydrase, that is GI tract, blood, kidney. In this, Polmacoxib binds to the CA in red blood cells of whole blood with low concentration in the plasma. And Polmacoxib shows reduced COX2 binding due to its competition by CH. So that will cause reduced adverse effect associated with COX2 inhibition in these organs. And RBCs transport large amounts of Polmacoxib in protected and inactive state to the tissues with low CA activities. CA is carbonic anhydrase. So in tissues with low CA activity, that is inflamed joints, Polmacoxib dissociate from CA, and that will cause increased concentration of Polmacoxib in inflamed tissue. What we have clinical evidence? There are phase 2 clinical trials has been conducted. I will talk about one study where this is a phase 2 clinical trial where in treatment A group, The Polmacoxib was used for 2 milligram per day. There were 40 number of patients in this group. Second group is treatment B group, where high dose of Polmacoxib was used, that was 4 milligram per day. And in this group, there were 42 number of patients. So these two groups are compared with a C group. This group consists of 43 numbers of patients, and in this group, Celica was given, dose was 200 milligram per day. And this clinical trial was conducted, and out of this clinical trial results, I will summarize that Polmacoxib 2 milligram per day and 4 milligram per day treatment groups demonstrated there were non-inferiority compared to Celica, which is a COX-2 inhibitor, on all primary and secondary outcome measures at day 28. There were no drug-related serious adverse events in either of the treatment group, that is treatment A group, B group, and C group. Despite the trial's short duration, because this is a 28 days, a very short duration, Polmacoxib showed no adverse events on heart functions, ECG profiles, or blood pressure, which are very commonly seen in other COX-2 inhibitors. So this is a cardiovascular safety. But due to this shorter duration of time, we can't say that this is totally safe in cardiac patients. So we have concluded that Polmacoxib was well tolerated and clinically effective in treating pain associated with osteoarthritis. We have conducted phase 3 trials. The study design was a phase 3 randomized, multicenter, double-blind, placebo and active comparator control parallel group trial for efficacy and safety approval and extended safety. Means it was used for longer period. So 6 weeks efficacy study to assess the safety and analgesic efficacy of Polmacoxib 2 milligram compared to placebo and Celica 200 milligram, which is a non-inferiority analysis in patients with OA of hip and knee. All the drugs were administered once a day. Another is 18-week extension study to gather additional evidence of safety data for those subjects who agreed to continue into extension, where all the participants received Polmacoxib. So this phase 3 study evaluated superiority of Polmacoxib over placebo and non-inferiority over Celica as pain relief medication for OA. If you see the chart comparing the placebo Polmacoxib 2 milligram and Celica 200 milligram, which are shown that at 3 weeks and 6 weeks. So after looking at the chart, we can say that Polmacoxib has fast relief, potentially faster onset of action in OA symptoms over Celica. Comparing on a OMAC pain subscale and OMAC stiffness, if you see the chart on my both the sides, so there is Polmacoxib demonstrated non-inferior or better efficacy against Celica in all other efficacy endpoints. at 3 weeks and 6 weeks. So what are the safety results? The reported treatment emergent adverse events were mostly mild and consistent with the expected side effects of COX-2 inhibitor drugs. Polmacoxib demonstrated a similar safety profile to Celica and other COX-2 inhibitor, which have a reduced incidence of GI disorders compared to other non-steroidal anti-inflammatory drugs. And we had done an extensive study also that showed the drug remained well tolerated with a comparable safety profile to initial 6 weeks treatment period and other COX-2 inhibitors. There were no notable increase in incidence of any adverse events. There were not any clinical relevant finding in the analysis of clinical laboratory tests, vital signs, ECG, or physical examination. So, in conclusion, I will say Polmacoxib 2 mg demonstrated superior efficacy to placebo and non-inferior efficacy and safety to Celica in treating osteoarthritis over a 6 weeks period. And the 18-week extension trial showed consistent results compared to the 6 weeks trial, suggesting that use of Polmacoxib is safe for long term. So, what is a take-home message regarding the newer drug Polmacoxib? It's a COX-2 inhibitor that has been developed recently, and it is now available in the market. So, it is a dual inhibitor, that is COX-2 inhibitor and carbonic anhydrase. So, this dual mechanism of Polmacoxib is believed to minimize the adverse cardiovascular events. It is well tolerated and clinically very efficient, and you can compare compared with the other COX-2 inhibitors. It is not inferior to them, and it has shown little bit superior. Also, it has to be taken once a daily dose, so convenient to the patients also, and it has got more half-life, so good one single dose daily. So, and it is very safe for long-term use and very little side effects. Thank you very much for patient listening. Hello.
Yes, sir.
So, did you have any questions?
Yes, sir. We already got few questions while your session was going on. So,
I will stop sharing. Yeah.
yes, sir. So I got few questions on my WhatsApp, so I'll read it loud for you, doctor.
Okay.
So first question we are coming up with is, can Polmacoxib be used in post-operative pain management?
Yes, can be used in post-operative management.
Certainly.
It is better and safer than the other non-steroidal anti-inflammatory drugs. So can be used in the post-operative period.
Right, sir. Noted. We hope that the question has been clarified for the concerned doctor. Sir, another question we are getting is, good evening, sir. One of the doctor asked about why you should not launch with paracetamol and Polmacoxib in combination together. So is there any need of paracetamol?
I think efficacy parameters are almost comparable or little bit superior to the Celica, you must have used the Celica, which is not combined with the paracetamol, and it has got good results. And whatever the clinical trials has been done, that is only the single Polmacoxib drug was used. So if you have to need in future, then we have to conduct the combination clinical trials, and then only we can use the that drug. At present, I personally, I don't think there is a need for a combination with a paracetamol.
Okay, Polmacoxib alone can take care of the pain management, doctor.
Yeah, it is more efficient and what do you say, longer period of effect.
Pain relief will be better with Polmacoxib alone.
Yeah.
Right, sir. Noted. So next question, will Polmacoxib use be ideal for pain management in stage 4 of osteoarthritis?
Stage 4 osteoarthritis, I will say it will not fully help to the patient, but we have to use the combination of therapies like you have to use the Polmacoxib, physiotherapy, few short diathermies, exercises, then the patient will be helpful. But stage 4 osteoarthritis will need some surgical intervention because it is a advanced type of arthritis. So only using Polmacoxib will not help in long term.
Okay, doctor. So what we can conclude is that along with the surgical intervention, Polmacoxib use will synergistically help out.
In stage 1, 2, 3, that is scale grading in ONE, you can use Polmacoxib very judiciously and it will be very effective. But in cases of stage 4, that is advanced arthritis, patient may not get the whatever effect we expect from Polmacoxib.
Noted. Noted. Dr. Ajit, I guess that your query has been resolved. So osteoarthritis stage 1, 2, and 3 is ideal for the use of Polmacoxib. Sir, another question we are getting from Dr. Siddharth Pawar. What is the maximum dosage of Polmacoxib that can be used?
For patients, we can use only 2 milligram per day, single dose. We have studied the 4 milligram per day, but we advise 2 milligram per day dose only.
Okay, Dr. Siddharth, please note that 2 milligram OD is the sufficient dose for Polmacoxib for management of pain. Sir, Dr. Vilas Savle is asking about the pediatric safety for the drug.
I will extend this question. Pediatric group, then pregnant women and lactating women, we don't advise at present, and it is at present contraindicated.
Sure, sir. Sure. So it is contraindicated for all these special population as stated by Dr. Pawar. Dr. Suraj Bagel is asking that whether Polmacoxib can be used in acute pain management.
It can be used in acute pain management also because it has got faster relief of pain.
Okay. Okay, sir. So Dr. Suraj, Polmacoxib 2 mg capsules can be used in patients with acute pain as well. And Dr. Sanjeev Khanna wants to know, can it be used in patients with duodenal ulcer?
Duodenal ulcer, because there is already duodenal ulcer, and all the COX-2 inhibitor causes increased GI disturbances or hyperacidity. So I will not advise in these cases.
Okay. Okay, Dr. Sanjeev, it is contraindicated in such patients with GI disturbance. So kindly use in your supervision. Again, he is asking whether patients with ischemic heart disease, in such class of patients, can this drug be used?
As per our studies concern, that is whatever in cardiac patients, we suggest that we can use it, and it is more safer than the Celica.
Okay, safer than celecoxib.
Can be used in the cardiac patients.
Okay, so Dr. Khanna, again, one of your questions has been addressed that it is safer, so can be used for CV patients as well. And sir, there are a few more questions coming up in our chat box that Polmacoxib should be used. Okay, acute has been addressed. Is it better than heterococci? Okay, yes. So these questions have been already addressed. Sir, I guess that all the questions which coming in our chat box also it's been addressed. Is it that better than heterococci? This is what we got the question is.
Yeah, definitely it is better than the heterococci.
Okay.
No doubt about it.
Yes. This was in taken care by sir in his session as well, that it is much, the molecule is better than heterococci and celecoxib as well. And sir, what are the benefits for the existing treatment options of Polmacoxib over the existing treatment options?
I am not getting you. What do you
So
want?
what are the potential benefits of Polmacoxib compared to existing treatment options is a query coming up to us.
Means this is a newer drug, and it has got faster action, early action, and half-life is better than all these celecoxib and called COX-2 inhibitors. It has got less GI problems. So it has got single daily dose is required, faster relief of pain, and longer duration of action. So these are the advantage over the previous all these drugs.
Okay, rightly noted, sir, that the advantages of Polmacoxib over the existing COX-2 inhibitors is far much better with the dosage compliance as well. So patient compliance also come in picture with the use of Polmacoxib. Great, sir. One more question we are getting is there any long-term delayed side effects for the Polmacoxib?
There are no any long-term side effects.
Okay.
If you consider the routine means gastrointestinal disturbances or means ulcerations, like, so we advise them not to use Polmacoxib in all these cases. We have GI ulcer or duodenal ulcers.
Okay.
As
So,
I said.
as you rightly mentioned, in the special population, it should be taken care of under the supervision when prescribed. And sir, is there any, there is one more question coming up to us is how soon the effect starts with Polmacoxib? Once patient starts taking the Polmacoxib, how the onset of action, how started happens?
It can act within a, I will say, if you want to say in minutes or hours, it will start acting within 30 minutes.
And so the dosage duration has been asked. What is the dosage duration for the Polmacoxib?
It is 2 milligram per day. And
Till,
it has to be taken with meals or some food.
okay, after meal.
Otherwise, don't take it on empty stomach.
Okay, 2 milligram once daily after food. This is what been recommended by Dr. Pawar. And sir, is there any specific dose adjustment or titration should be done if the age is higher, if the patient is in geriatric age more than 65?
Usually, we say ki for all these special population, like patient having some kidney disease, geriatric population, we should lower the dose and make it half.
So the dose adjustment should be taken care of if the patient is on a higher age, more than 65 years of age, while prescribing Polmacoxib. So this is what has been recommended by Dr. Pawar. So are we having any more questions? So Dr. Vikas Mehra is asking us that, no, sorry, Dr. Sanjeev Khanna is asking us that, can it be used in combination with pentaprazole in GI cases, in patient with GI?
If patient is already receiving
Study.
pentaprazole, I think Polmacoxib can be given. There is no contraindication.
Okay.
For him, I will read all the drugs which are contraindicated, which having drug interactions with the other drugs with the Polmacoxib.
Sure,
That
sir.
is ketoconazole. Then AC inhibitors has got some drug interaction with the Polmacoxib. Then diuretics, lithium, methotrexate, anticoagulants, cyclosporine, corticosteroids. So all these drugs have some interaction with the Polmacoxib. So whenever we use all these drugs, the precaution should be taken and patient should be cautiously observed.
Certainly, sir. I hope our audiences have noted down that which are the drugs sir have mentioned just now, that they could be possibly contraindicated with drug interaction can happen with Polmacoxib usage. So kindly prescribe under your supervision when given to the patients who are on these drugs as well. And sir, we have one more question.
Varsha,
Yes,
I
sir.
will say the special contraindications in, like I have already said, if there is a peptic ulcer, duodenal
Yes.
ulcer, so whatever GI system has got any ulceration, better to not to use the Polmacoxib.
Okay, sir.
Then the patients who are having allergies to the sulfonamides are also advised not to use this drug. They may get the allergic reactions. So, and all these peptic ulcer, gastrointestinal GI bleed, that is contraindicated. Then another is the patients who are on anticoagulants, because if the patient is taking some anticoagulative drugs, the Polmacoxib has got drug interaction with all the anticoagulants. So that has to be monitored, or better to be not to be given in these cases.
Right, sir. Right.
And that is already said, pregnant woman, pediatric population, and lactating woman, the drug is contraindicated.
Okay. So audiences, I hope that we have noticed that sir have recently mentioned that for which special population the Polmacoxib 2 milligram is contraindicated, and also he has specified that for which drugs possibly interaction might happen with Polmacoxib. So while prescribing for such population and while prescribing for the patients who are on such drugs mentioned by Dr. Pawar, special supervision should be taken care of, and those patients should be followed up regularly when they are kept on Polmacoxib 2 milligram. Sir, one question we are getting regarding the renal toxicity on the long-term use of Polmacoxib.
I think we have studied for almost 18 weeks use of Polmacoxib, and in that clinical trial, it is said safe. So whatever, if the patient is going to keep on using the drug for months together, then definitely it will cause a problem to the kidney.
Okay. So again, here supervision should be taken care of. Well,
that rule applies to even heart diseases also. Short-term use we can advise, but in long term or very high doses is not advised in heart diseases. It is said that it is more safer than the Celica, which for Celica totally contraindicated for cardiovascular diseases.
Yes, so it is safe.
Yeah.
Sir. It is safe for CV patients as well. CV safety is the prime advantage of Polmacoxib over other COX-2 inhibitors. Right, sir. And once again, the way I got a question that we can be used in other indications as well. You have mentioned in post-operative pain we can use, but in acute also we can use. Shoulder pain, back pain has been specified, doctor. Can in these indications, Polmacoxib can be used?
Yes, can be used.
Okay, okay. So we hope that the query came from the doctor has been resolved.
Because
That it can be used.
this is a painkiller drug, and it has COX-2 inhibitor drug. So wherever pain is there, it can be used.
Okay. For any painful conditions, Polmacoxib can be used. This is a word from Dr. Pawar. And are we having any more queries? The questions in the chat box are also being addressed up till so far. So the Tmax of the molecule is being asked. That it has been questioned that what is the Tmax of Polmacoxib?
Tmax or half-life?
Yes, sir. This is being questioned.
It is said that it has got longer half-life. Exactly mentioning in hours is little bit confidential, so we will opine later on.
Certainly, sir. Certainly. So because of the better half-life, OD dose convenient is there with Polmacoxib. This we can conclude, doctor. And this has been addressed by you as well in your sessions. So, and the duration of treatment and how many weeks has been already addressed by Dr. Pawar. This is for 2 milligram OD. If I'm not wrong, sir, you said for 10 days minimum.
Usually it has to be given for a short duration, but
Yes.
you can use it for 6 weeks.
Okay.
We have got a clinical trial which was extended, but that population is totally without any comorbidities.
Okay.
And whatever we have mentioned, special population like GI problems, cardiac disease, in these patients, I will advise them for only 5 to 7 days.
Okay, sir.
Kidney people. So for a special population, it should be used for a very short duration. If patient doesn't have any comorbidities, then we can go for almost 6 weeks.
Okay.
More than we have got studies, but I will not advise using for such a long period.
Certainly, sir. Noted. Dr. Vikas, we hope that your question has been addressed and you have made a note of it that for comorbid patients, it should not go beyond 5 to 7 days of the treatment period. And for the population who are not comorbid, not beyond that 8 weeks, 6 weeks, as recommended by sir. And in your supervision, it should be taken care of. So, sir, we think that our queries are over for today's evening. And it was quite interactive. I hope that our audiences, the queries from our audiences has been addressed well, and this might make them more confident for the use of Polmacoxib 2 milligram capsules for pain management in their patients. And thank you, sir. Thank you once again for your valuable time.
Thank you. Thank you, everyone.
Thank you, doctor.